There are many risks to delivering before 39 weeks gestation.
This is a pinfoot going to full term.
There's a large amount of development that occurs between 37 and 39 weeks, and that development affects the lungs and the gastrointestinal system the most.
How's everything going in your pregnancy?
The worst case scenario would be for a mother to deliver before 39 weeks by her choosing, and then the baby gets sick and has to be sent to an ICU elsewhere, and she's here.
There were a variety of different ways in which we supported our staff, our clinicians, in the pursuit of the reduction of early elective deliveries.
That's a really good question.
And I think one of the most important ways in which we supported them is through our commitment to a very deep learning, collaborative environment.
And one of the OBs had also said...
I think just as importantly, we were able to, by our participation in the HEN network, we were able to see what other institutions were doing from a best practice perspective.
This is what we're encouraging.
When we first presented our baseline data on early elective deliveries, we saw that we were actually at a 35% rate. That was unsettling to the physicians. Just showing them that they were at that rate, we dropped to about 29%. And then from there, after we had some process changes, we've gone to 0. The data needed to be looked at on a monthly basis, and that HEN template assisted with that.
We clearly saw the gap between what the early elective deliveries rate was in our institution versus what the goals were being established by the Hospital Engagement Network. And we clearly saw that by closing that gap, we would almost immediately benefit our patients. And as we set about doing that with some very direct interventions, working with our providers, we saw that gap very rapidly closed to 0.
I think our success in reducing early elective deliveries is due to 3 primary focuses. 1, we took the awareness to the physicians about the fact that they were having early elective deliveries. 2nd, we educated people on how to reduce those things. 3rdly, we made a change in our booking form. Having the hard stop of 39 weeks is essentially drawing the line in the sand and sticking to it. It is best practice, and that's what needs to be done. Plain and simple.
The goal of all obstetricians is to have a healthy mother and a healthy baby. Once you've had a baby, you just want to bring that baby home to all their stuff and to their family, and being able to do that in the normal time within 2 days of delivery, 2 to 3 days of delivery, depending upon if there's a C-section, is great. They get back to where they belong, which is home with their family.
Our success with reducing the rate of early elective deliveries to 0 was really in many ways a very catalytic moment for us. We realized what we could do and saw no limits really to what we could do. And I think with the support of the Hospital Engagement Network, we're on our pathway here.
Thanks for tuning in to H&HN Daily's special coverage of the Health Research and Educational Trust's Hospital Engagement Network. This project has been brought to you by the Center for Medicare and Medicaid Innovation, the Partnership for Patients Initiative, the American Hospital Association, and the Health Research and Educational Trust.